I'm Associate Professor David Rosenfeld, please call me David. I'm trained as a pathologist and as a medical oncologist. So my work is clinical hematology, but my history includes the fact that I've actually set up a laboratory and run a laboratory for quite a few years and built this service up. I've built a service from one hematologist to one of 12 hematologists. We saw an occasional patient when I first started, and when I finished building the service we were seeing 400 patients a week in clinic, and I was running a laboratory service, so we're processing about 2,000 samples per day for a population of about 1 million people. I consult with patients regarding hematological problems, about problems with their blood. They can be too much blood, too little blood, too many white cells, too few white cells, or oncological issues such as cancers of the blood, which includes leukemia, lymphoma, myeloma. These are the main hematological conditions that we treat. I was asked why I entered hematology. I find this specialty fascinating because it ties up very sophisticated laboratory services with a clinical service where you actually get to talk to patients and treat them. And one of the beauties of hematology is that our therapies are very effective compared to some of the other oncological services where the treatment's not quite so good. So I find this very really edifying to help people in this way. My services here would include providing expert witness reports. I would not expect to be actually interviewing or examining patients in this sphere. I would be reviewing medical records. Someone suggests there's been a poor outcome which could have been better, or something was missed, or there are some issues that are relevant to the case. I would be happy to review the records, or any records that are available, and offer an opinion, or do a proper expert witness report under the usual rules and regulations. I've undertaken reports as an expert witness for the Administrative Appeals Tribunal, where a patient's pension was cut off because someone decided that they had a pre-existing illness. I was able to review all the records and show that this had all occurred in recent times. It was not a pre-existing illness. So I was able to help the client and the lawyers in this case. Well, basically, I help to provide clarity. I can identify issues that may not be obvious on first or second perusal of the papers. I review the papers. I often, on the records, the clinical records, I'll often find issues that may have been overlooked in the past. I can help to identify issues that may not be evidence in the first instance. And I also can help to focus the area of attack or the defence that would be more appropriate using my clinical acumen, understanding that I've been seeing patients and been in charge of a department now for over 30 years. I'm hoping that, as I said, to provide clarity and also help to facilitate the outcome that we're seeking. But usually I'm doing this for the benefit of the patient, where they can get a better outcome than if I hadn't contributed. To provide clarity, to provide closure, to get the outcome that we're all seeking.